大家晚上好。我们今天是这个专题演讲，是王春莲博士和我们讲解这个新冠肺炎疫情的最新发展。So today this is our Sunday evening lecture series, and today actually is a monthly update on the COVID-19 pandemic. And speaker today is Dr. Chunling Wang. I think people are probably familiar with him because he has been giving his talk for a few times. 今天晚上是王楚莲博士和我们分享这个疫情。大家对王博士应该不陌生，因为他已经和我们讲了有几次。Dr. Wang was trained as a medical doctor in China. Then he came to US to study at the Johns Hopkins University and finished his PhD degree in epidemiology. 王博士他早年是在中国是读医学院，毕业以后到美国来，在那个马里兰州的 Johns Hopkins 大学攻读流行病学的博士。所以今天他和我们讲的这个是他很在行的。So I'll just stop here and let Dr. Wang start. You can share your screen now, Jenny.
Sure. Let me.
Share.
Yep. Let me share my screen. Can you see the screen?
Yes.
Okay. And thank you, and Master Young, and for the masters in interference. It's glad to be here, to back again, alive, and to share with you the most recent update on the COVID-19. 谢谢金法师的这个前面的介绍。宣公上人，各位法师，各位法友，大家好。很荣幸今天能再次回来跟大家分享我们在新冠肺炎最近1个月的一些进展情况。And Dr. Chowler last weekend and already did a great talk and had a nice an overview of how the frontline healthcare worker look like and how their daily life look like. And today I would just focus from a public health perspective and also from the recent scientific research development perspective. What are the exciting advance in the vaccine and treatment area? 上周呢，那个Dr. Martin Chowler 在这个新冠肺炎这个医疗前线呢，做了一个比较精彩的一个演讲。所以今天我这个演讲呢，主要是讲这个从这个公共卫生的角度、疫情流行的角度，然后另外就从这个科研，就是尤其是疫苗和这个治疗方面科研进展的方面，给大家做一些简短的汇报，简要的汇报。I first start from pandemic. So this is again, I like this figures and dashboard. So this is by early this morning, 9:26 a.m. California time, and global wise, look at the left corner here, 58 million cases. This is how much we got confirmed cases within 11 months of global pandemic. And global-wise, we already had close to 1.4 million deaths. We all know these numbers are grossly underestimated since a lot of COVID infection patients never get diagnosed. And also look at the figure here on the right on the bottom. This indicates daily confirmed cases. Right now, every day globally, we have close to 700,000 new cases confirmed every day, and about 12,000 new deaths confirmed related to the COVID-19. So you look at the slope of new infections here clearly, and this global pandemic's even not slow down, even accelerating, especially in the recent couple of weeks moving into October. And while we have some exciting news for the vaccine, but clearly this pandemic is accelerating, and we will see things get worse before it get better. 用中文简单讲一下，这个是这个霍普金斯大学 他们提供的这个全球这个新冠肺炎流行的一个汇总。截至今天早上9点半加州时间，全球已经报告了确诊了5800万病例，然后到现在为止已经有将近140万的这个死亡人数。然后我们也知道这个人数呢都是被严重低估的，因为很多这个新冠感染的患者根本就没有确诊。然后呢，这个右下角呢显示的是每天新确诊的这个病例数，从疫情开始一直到现在。然后我们先看到现在呢，基本上每天全球大概有将近70万的确诊的病例。然后这个表呢是每天因为死于新冠的病例数。然后我们也看到现在每天全球大概将近有12000例死于新冠。然后呢，我们看一下这个每天的新发病例数，我们看它的这个增长的这个趋势和这个曲线，就可以看得到，现在全球的这个新冠的流行不但没有减缓，而且甚至尤其在最近进入10月份以来，甚至有一个加速的趋势。虽然我们现在有了比较理想的疫苗，现在这个好的疫苗，大家也可能也听到，我待会儿也要做一个介绍。现在有好的疫苗出来了，但是在疫苗这个普及接种之前，这个全球的流行还会进一步的加剧。And then move into kind of drill into the country by country and the region, which country impacted the most or contributed the most to the global pandemic. So this is by the daily new confirmed case. How do I move this one? Okay, so clearly we see in the United States, unfortunately, and contribute the most. About 30% global new cases, confirmed cases are coming every day coming from the United States. And the last September, when I introduced this figure, and there are other countries and also heavily impacted by COVID-19. One is India, another one is Brazil. But now I think both countries are making progress in terms of control the pandemic. And for example, this blue line is India. They peaked at September, and then they reversed the curve. Now compare the peak time, the current daily confirmed cases reduced by 50%. And then this dark blue line is Brazil, and they peaked about in August, and then also flattened the curve ever since. 所以这个呢，中文简单说一下，这个就是我们再仔细看，全世界的国家和地区，哪个国家受这个新冠现在影响的最大，或者说哪个国家在全球流行中间是重灾区。首先，第一个我们看这个每天新发的病例数，这个美国呢是非常显眼的，就在现在就显示出来，现在全球每天报告的新确诊的病例数30%是来自于美国。然后上次9月份的时候，我做的报告中间有其他的国家也受这个新冠的影响比较严重，其中一个就是印度，另外一个就是巴西。但是我们看到目前截止到今天，这个蓝色的线是印度，这两个国家就是印度和巴西到现在已经都取得了比较显著的进展。比如说像这个蓝线是印度呢大概在9月中旬、9月底的时候呢达到一个峰值，然后每天确诊病例数就开始下降，然后到现在为止已经降了大概50%，相对它峰值的那个时候的那个每天新发的病例数现在已经降了50%。然后这个是巴西，这个深蓝色线是紫色线是巴西，巴西呢是在8月份达到了这个峰值，然后从那以后开始逐渐下降。没有像印度那边下降的明显，但是他们的基本每天新发的病例数保持一个平缓的趋势。Then there's a few other countries, and it's quite hard to differentiate here, so I'll show you the next slide. And then to be fair, because each country have different size in terms of population, so this is number of cases per million people, and again we can see the country got impacted the most. United States still on the top here, and then a few other West European countries stood out. This is France, this is Italy, and this is UK, this is Spain, this is Germany, all ranked to the top. And also interesting to see the peak the number of daily confirmed cases, in this wave, in Europe, called wave 2, is significantly higher than early in March, April, in the first wave, and also higher in the summer research. And the good news is in these Western European countries, and it looks like from the pandemic curve, looks like they were able to turn around the corner and start a downward trend. For example, this is France, is a broad line here, and compared to where they had a peak value a couple of weeks ago, and now they're reported and daily confirmed new cases have a 50% reduction. And Italy also had turned around the curve there as well, and the same similar thing for Spain and the UK. But again, United States still on the upward trend. 用中文简单的总结一下，这个呢就是从另外一个角度来看，就是因为每个国家它的人口基数不一样，所以你只看每天新报的病例数呢，它没有计算这个人口的基数，也不是一个很好的总结方法。这个呢就是总结了在100万人口中间，每天100万人口作为一个单位，然后每天那个报告的新发的确诊的病例数有多少。所以在这里面，我们突然就看到，除了美国之外，美国仍然是在这个排在第2位，排得非常靠前的。然后西欧的几个小的国家突然就跳出来了。然后呢，其中像这个棕色的是法国，蓝色的是这个意大利，然后后面这个英国和西班牙。然后他们这个最近的这个是从他们的国家来看，主要是第2波的疫情的爆发呢，要明显要比第1波疫情这个新发的这个病例是要高很多。但是呢，就是好的消息就是从这个爆发的曲线来看，他们最近确实在这方面取得了一些进展，比如像法国。它的最高的爆发和现在最高爆发时候的那个每天报告的新发病例数和现在的这个数量已经有比较大幅度的这个下降。然后像意大利和英国还有西班牙，他们也基本上就是似乎已经达到了一个峰值，开始往下走的趋势了。但是美国呢，现在还是仍然往上走的趋势。And then let's zoom into the United States. And this is a total summary so far by this weekend, but the past weekend, about 12 million confirmed cases and more than 250,000 deaths. And just last Friday, just one snapshot and close to 2,000 new cases and 2,000 deaths. And all represent about more than 60% increase compared to 2 weeks before. And also, interesting enough, as I mentioned before, in US, which probably reflect how fast acceleration the pandemic it has been. In the first 1 million new cases and take about 4 months, but the last 1 million new cases in the United States occurred only in the last 6 days. And also in the US, in November, this is a month the country reached another milestone and had 1 million cases in pediatric patients. So right now, about 1.1 million cases in pediatrics account for about 11% of the total COVID cases in this country, about 1 to 3% of hospitalized COVID cases in this country. And so just look at this figure, you can clearly see the situation in the US is getting worse. That's why, and right now, if you read the newspaper on the media, each state, a lot of states are taking more stringent measures and curfews and closing the schools and restricting on the gathering, etc. And also, this figure shows on the bottom shows the daily new confirmed COVID death. It's just a few words about that. And although if you look at the newly confirmed cases on the upper figure here, and the most recent surge is significantly higher than here, what happened in March, April, but the death case didn't follow, indicating the case fatality rate has been significantly lower in this way, in the current wave. There are a couple of reasons. Number one is patient population different. This is significantly younger than this stage, and which is 20 years younger. So generally, patient has stronger immunity and less comorbidities, etc. And another reason is there's any other reason is also hospital healthcare system are better prepared currently compared to when the pandemic first hit the United States. We all remember all the nightmares in New York City, the ER department. And also third reason is right now, all the doctors and nurses, and we know better about the disease, they have better treatment options, right? We do have a couple drugs we know are effective at different stage of the disease. And another factor contribute to that is, I think Dr. Trotter last week mentioned, and when people wear the mask and likely when they get infected, likely the viral load, the numbers of virus they get infected into their body is significantly less. That may also contribute to the less severity of the disease. And however, even with the lower and case fatality rate, but given the number of cases has been significantly increased, and the number of deaths, which is from public health perspective, how many people really die from the disease, will continue going up. That's the third point is also the death is a lagging indicator. So you see, first you will see the increase on the confirmed cases, and generally 3 to 4 weeks later, you will see the number of deaths kind of trailing up. So it is very likely, and what we're seeing here is only an early sign of increase on the death curve moving forward. 用中文这个简单讲一下，这是美国现在的这个流行的状况，但总体截止到这个上个周五的时候，全国有超过1200万的这个确诊的病例，然后有超过25万的这个死亡的病例。然后在周五这一天做一个 snapshot 的话，大概有一天大概有20万的确诊病例，将近2000的死亡病例。然后呢，同比较2周之前，这个数字呢都大概60%以上的增加。就进一步显示，现在这 curve 基本上是疫情是属于是一种加速期。然后呢，从另外一个角度来看，就是做一个形象的这个比喻吧。在美国这个流行开始的时候，出现第一个100万病例，100万的这个确诊的病例，大概花了3个月的时间，400万的病例呢，只花了6天的时间。而且这个速度将来会越来越快。然后呢，就是说在10月份呢，美国也就说美国的这个儿童中间这个新冠的病例数呢，也达到了一个比较高的水平，达到了100万例。现在儿童在美国这个新冠确诊数中间占到了11%，然后因为新冠住院的病人中儿童的比例大概在1%到3%。这是美国那个儿童医学会的做的报告。然后呢，下面这个图呢是这个因为新冠死亡的病例我们看到这也是一个随着时间变化曲线。虽然在看每天确诊的病例中间，现在这个趋势，现在这个时间是非常高的，但是我们这个死亡病例呢，并没有像3、4月份的时候那么高。这里面有几个原因，就是现在这个得病的这些患者跟3、4月份时得病的患者基本上情况不一样。现在的患者相对比较年轻，然后他们得的病的严重程度比较低，然后他们的免疫状况各方面也没有慢性的疾病，所以相对状况比较好，所以这死亡的几率也比较低。另外呢，就是现在的医院呢，就是说资源各方面条件也比3、4月份要好，然后现在这个医生护士呢，他们也比较有经验，然后现在针对这个新冠的治疗呢，也有些比较有效的方法和药物都出现了。然后另外一点就是这个有一些这个假设了，就是说现在人们戴着口罩啊，什么其他个人的保护措施做的比较到位的话，即便这个人他被感染了，那么他可能进入他体内这个病毒的这个含量，病毒这个数量相对比较低，所以直接导致他这个得病的程度相对比较轻。这些都是导致这个现在这个最近这段时间这些新冠确诊病例他们的疾病的严重程度、死亡率比较低的原因。但是从公共卫生角度来讲呢，因为现在这个患病的人数 基数太高了，所以即便它的死亡率降低，那么总体的死亡人数也是在逐渐往上升的。然后最后想说一点，就是一般这个死亡这个曲线呢，总是落后这个确诊这个病例曲线落后大概3到4周的时间，所以很有可能在后面的几周时间，我们会看到这个死亡的曲线逐渐跟上来。And there's always a notion about, the reason the United States have a higher number of cases than other countries because we're doing more tests than other countries do. So this figure actually shows, and indeed we're doing more tests over time. But if you look at the slope of the tests we're doing, you compare to the slope, especially in the recent time, in terms of increased cases, there's no match on that. So that's a clear indicating and doing more tests doesn't explain and a significant increase on the new cases, right? This is number one. Number two, if the pandemic did not getting worse and doing more tests, and the positive test rate shouldn't be changing. So this figure actually shows the positive test rate, which is not the case, especially start from October. The positive test rate has been dramatically increased, right? And also the third point I want to mention, and the positive test rate here in March and April, and because at that time the test in the United States was really limited, only people have the symptoms get tested. That's why you have such a high positive testing rate here. But now the tests become widely available, and people with or without symptoms all get tested. So then this significant spike on the test positive rate, clear indicator the spread of the virus in the community setting. 这个 slide 想解释一点，就是因为我们经常听有人说，在美国这个我们看到越来越多的病例，实际上不是我们美国疫情变比其他国家差，而是因为我们国家做的这个检测比较多。实际上这个 slide 就想说明这个问题，实际上不是这样，因为首先你先看上面这个曲线，这是美国每天做的检测的数量，确实我们这个检测的数量在增加，但是增加的这个趋势和我们这个前面这个每天出现新的确诊病例的趋势是绝对不能比的，这个趋势非常非常的明显，就是它这个 slope 要比这个检测增加 slope 要明显大很多，这是第一点。第二点，如果是这个疫情没有变差，只是增加这个检测的话，那我们这检测出来这个阳性率应该是不会变化的。但是这个下面这个图呢，是我们检测出来的阳性率。我们看到，尤其在最近从10月份10月份以来，这个检测的阳性率是有明显升高的。第三点就想说的就是在3、4月份的时候，这时候这个检测阳性率也是明显高，因为那个时候呢，在美国这个检测的试剂是有限的，所以只有那些有症状的病人才可以接受检测。但是现在呢，美国现在这个检测试剂盒基本上已经普及了，所以基本上已经普及到社区了，有没有症状都可以做检测。所以你现在看到最近的这个明显的这个升高的这个阳性检测率，反映的就是这个疫情在这个社区中间流行的这个程度。And this is from statewide. So Texas right now is ranked number 1 regard to the number of confirmed cases. And New York State is still ranked the number 1 regard to the death due to the COVID-19. And California is ranked number 1 in terms of number of tests offered. And this is cumulatively, but look at the current pandemic situation. The country, and with the dark blue here, and Germany has the highest number of newly confirmed cases per 100,000 population people. So those are generally most are the Middle West states, North Dakota, Wyoming, South Dakota, Nebraska, and Minnesota, etc. Those also, if we know, those also are states and largely and against all the stringent preventive measures. 这个呢，就是从这个州的角度来讲，现在美国报告病例数最多的州就是德克萨斯州。我记得9月份报告的时候，当时加州还是排第1位，现在已经被德克萨斯州超过了。然后死亡率病例最多的是纽约州，然后呢，加州呢实际上是这个检测病例最多的州。但是呢，这个当然是从这个总体的，就是这个总体的角度来看，疫情流行到现在从角度来看，但是我们就看最新的这个疫情的话，实际上最严重的几个州呢，基本上都是在美国的这个北部和中西部吧，然后包括像这个北达科他呀、怀俄明啊、South Dakota 这些州。Then look at California. And right now, California, and by this Friday, actually already tested 21 million and over 21 million tests, and with about 1 million confirmed cases and 19,000 deaths. And so look at the pandemic curve or longitudinally, you can see clearly California has a spike in the summer and July, August. When I give the talk September, I mentioned that. And then the newly confirmed case started gradually come down, and then recently and start spike again. And last Friday and had the single day had 13,000 new cases. So the most recent number already surpassed the peak case number per day in the summertime. And then look at the death related to the COVID-19, again, corresponding to the peak in the summertime. And the August has been the deadliest month for California with regard to COVID-19. And that number of deaths has been gradually decreased due to the decrease in the newly confirmed cases. And then with increased on the new cases, new infections, and number of deaths also started trailing up again too. 这个呢是加州的这个一个流行曲线的这个分析图。加州到目前为止呢，已经做了2100万的检测，然后呢，确诊病例数呢已经超过了100万，然后死亡病例数大概接近了19000例。然后呢，看他们总体的这个流行曲线呢，在今年夏天7、8月份的时候有一个明显的这个峰值，然后逐渐下降。然后呢，在进入10月份到10月份的时候，开始有第二波的这个增加。在上个周五的时候，一天的这个新确诊病例数已经达到了13000例，这个数字已经超过了夏天时候的最高的峰值。然后死亡病例数也是这样，跟这个确诊的新冠病例数是趋势是差不多的。随着在7、8月份的这个确诊病例数的增加，在8月份的1个月，加州呢是这个因新冠病例死亡数是最高的1个月。然后呢，这个死亡病例数开始逐渐下降，然后最近呢又开始有抬头的趋势。In Mendocino County, this is by last Friday, and total 1,385 confirmed cases, 22 deaths, 9 hospitals, 0 in ICU, which is a good thing. And so far, we're still in tier 1, which is a most stringent category at the county level based on California and the guideline. And until this number, which is newly confirmed cases per day, decreased to 7, lower than 7, will stay in the tier 1. Everything else really didn't change. AD category, ethnicity, and source of infection really did not change. Then, and look at the Mendocino County, the pandemic longitudinally. We see a similar trend here. This is newly confirmed cases. Similar trend to California state, right? We had a peak in August, then started decreasing, and then pick back again recently. And so compared to 7 days ago, the county has about close to 80% increase. And compared to last I report in September, and we had about 4 more deaths, and increase from 18 to 22 deaths. The good things right now, there's 0 cases in ICU due to the COVID-19. There's any other things to mention? Oh yeah, and outbreak, right? So in September, I mentioned there has been outbreak in Redwood Cove, a nursing home, and ever since recently, last week or so, there's another small outbreak in a local hotel, but has been quickly controlled. Right now in Mendocino County, most of the cases occurred and based on home, clustered by home due to the close contact, and followed by the community spread. 这个呢是这个我们Mendocino 这个县现在的这个。I didn't say this in Chinese. 这是我们的新泽县现在的情况。一直到上个周，我们有1385例的确诊病例，然后死亡病例是22位，然后9例住院的，但是我们现在没有住在这个重症监护病房里的，这是一个好的消息。然后呢，我们现在还是在加州这个 Tier 1疫情最严重的这个 category 里面，直到这个数量降成7或者更低，那我们就会按照加州现在的这个 guideline， 只有这个县的这个每天的这个报告数降到7以下才能只要是在7或者以上呢，就是处在现在这个 purple 紫色的这个 category。用中文简单，这个Mendocino County 的这个新发病例数的这个曲线呢，时间的曲线跟加州这个整体是非常接近的。夏天有一个增高，然后呢开始缓解，然后最近呢又开始有增高。10月份的时候就新死亡了4例的病例，然后呢上次谈到了在我们附近的一个老人院，这个 Redwood 这个 Cove 的9月份的时候有个老人院有个集中的爆发，那么最近呢又在我们这个附近这个当地的一个小的这个旅馆也有一个小的爆发，但是很快就被控制住了。现在我们 Mendocino County 主要的这个疫情流行主要的原因是这个家庭里面的这个亲密接触的传播，另外就是找不到原因的这个社区传播。I next really want to spend some time on the vaccine. Because we have some exciting news on the vaccine front. So we know for vaccine development, the phase 1, that's where the smaller number subjects and to testing for the safety. Phase 2, you got couple hundred subjects and to look at efficacy. Phase 3, basically you confirm efficacy and safety. And then you move to the prove and post-market phase. So ever since January, when the sequence of the virus get posted and announced in the public platform, only 10 months, literally 10 months, we already have 13 vaccine candidates in the phase 3, which is the last stage of the vaccine development. This is really unprecedented, a great achievement so far. And also FDA and US FDA also established their criteria from phase 3 to approval. They basically put 2 criteria. Number 1, the vaccine in phase 3 have to demonstrate at least a 50% efficacy. And number 2, and 50% of patients have to be followed at least 2 months after their last dose vaccination. And right now, there are 2 vaccines already reached that threshold, and I think way above the bar. So I'd like to give that a little more detail next slides. 这个呢是现在我们这个新冠肺炎这个疫情这个研发的一个非常简短的一个总结的这个 slide。我们知道这个1期实验主要是小规模的实验安全性，2期呢开始看这个有效性，3期呢基本上一般都是几千人以上的这个临床实验，是确认我们的安全性和有效性的。然后呢就是新冠这个病毒呢从这个把这个病毒基因测序，然后做完以后，然后放到网上公之于众以后，那是1月份的事情，到现在10月份，短短的10个月的时间，我们现在全球已经有13个疫苗已经进入了这个 第3期的临床实验，这是在疫苗上市之前最后的一个阶段。如果大家想想，这个一般这个疫苗的这个研发卷，从研发开始到最后上市，大概平均5到10年的时间。我们现在13个疫苗在短短10个月就已经进入到第3期实验，这是一个基本上可以说从来没有完成过的一个非常了不起的一个创举，从疫苗研发的角度来讲，然后呢，美国的这个食品药品管理局呢也明确了也公布了非常明确的标准，疫苗想要在美国 FDA 获得批准的话，它在这个有效性方面必须做到50%，至少达到50%的有效性。就是至少能够预防50%的这个感染。然后另外在安全情况下，它要求所有的3期临床的实验的这个受试者，在接受完最后1剂之后，有50%的人至少能够有2个月的这个安全性的这个数据收集。现在呢，我们在10月份呢，有2个疫苗已经做到了这一点。然后呢，他们的结果出来以后都是非常震撼人心的。下面我会详细的介绍一下。然后these 2 vaccines I talk about and that have encouraged results all belongs to one category of vaccine called mRNA, messenger RNA. So, and just help people understand what the vaccine is about, and this figure had the illustration. And basically, an mRNA vaccine actually including some genetic materials as part of the vaccine, and which really contains a gene sequence and which can encode a fragment of the viral protein. In COVID-19, this is a spike protein, basically the protein and stuck on the surface of viral particles, and virus is used to engage with ACE2 inhibitor on the human cells to infect the human cells. And also because mRNA is very unstable, and so the vaccine, the mRNA has to be protected and surrounded by a nanoparticle, a lipid nanoparticle to protect that mRNA. So the vaccine, after it had intravascular injection into the human, they will fuse, and the lipid particle will fuse with the members, human cells. The mRNA get into the human cell cytoplasma. That's where they use all the machinery there to produce the protein with mRNA actually intend to express. And in this case, it's a spike protein. And once a spike protein gets produced, they get released from the human cell. That's where they get picked by the human immune system. And basically, this will set off the alarm. So in the future, when the real virus and invade the human cells, the immune system will recognize and attack. 因为这两个疫苗呢，都是这个属于一种的，就叫 mRNA 的疫苗，所以这个图呢，大概讲一下这个 mRNA 疫苗的这个作用和机理。因为 mRNA 呢是指上就是一个指上一段非常小的这个遗传物质，这个遗传物质呢，它里面就是包含了这个病毒表面一个叫 spike 蛋白的这个遗传基因的密码。然后呢，因为这个 mRNA 这个物质本身是非常不稳定的，所以它在外面的时候必须要用一个要有一个那种脂蛋白做一个保护，做一个鞘膜的保护。然后呢，这个疫苗呢被通过肌肉注射到人体以后呢，这个 mRNA 呢就会进入到人体的细胞里面，然后在这里呢，它就用细胞的一些这个细胞的器官，然后把这个 spike protein 蛋白呢表达出来，然后从细胞里面再释放出去，然后人体的免疫系统呢就会遇到这个 spike protein 呢就会产生免疫的反应。这样的话，将来真正的当有病毒来入侵的时候，人体的免疫系统就能够迅速的识别这些病毒，然后进行攻击。这就是 mRNA 疫苗作用的机制。The first one is Moderna, and this is a vaccine and actually co-developed between Moderna and the U.S. National Institute of Health. And so that's why they got initial funding in January when they started develop the vaccine, already got $1 billion support from the U.S. government. And the preclinical and the first early stage human trial looks really promising. Also, the vaccine looks like it produced and was able to produce a strong immune response even in elder patients, which is the vulnerable patient for the COVID-19, which is really a good thing. So initially phase 3 in July and more than 30,000. And then August, giving the early results, encouraging results, and then get additional $1.5 billion contract from the US government for 100 million doses if the vaccine turned out to be successful. And Canadian government followed. And the second, 这是第一个疫苗，就是大家都知道 Moderna 的这个疫苗，它是现在这次新冠疫情 mRNA 这个疫苗研究中间的一个新星，是一个小的公司，它和美国国立实验圈一起联合开发的。1月份的时候呢，美国政府就出资10亿美金来资助这个疫苗的发展，然后前期的这个动物实验和早期的人体临床实验结果都很好，然后这个疫苗在早年人中间这个出现的效果就是刺激的免疫反应，达到免疫反应也非常好，所以这是个非常有有利的这个消息。然后这个7月份的时候开始了3期临床，预计是3万这个健康的志愿者只在美国做，然后8月份的时候呢，因为这个前期的结果是非常理想的，所以美国政府呢又给了这个疫苗15亿美金的这个一个合同。这样疫苗如果成功的话，美国政府就出钱买它1亿这个 dose。The second vaccine is co-developed by Pfizer BioNTech. It's with a small company from Germany and Fosun Pharma from China. And this vaccine didn't receive any funding from U.S. government, and they had phase 1/2 in May. So this vaccine started late, but catch up really quick. I think this speaks for the experience and research from Pfizer as global pharma, and started phase 1/2 in May, and then phase 2/3 in July, which is literally less than 2 months later. And the phase 3 initial plan to be 30,000 and then expanded to 43,000 September. And then early this month, they already announced encouraging interim results. 第二个疫苗呢是这个辉瑞，然后德国的一个小公司叫 BioNTech 和中国的一个公司叫复星医药，他们联合研发的。这个疫苗呢开始的比较晚，但是进展却是最快的。这可能也就是我们辉瑞制药公司的这个国企的这个实力啊。5月份才开始的1期、2期实验，然后7月份就开始了这个2期、3期的实验，2期、3期并在一起做的。然后预期本来是3万例这个健康志愿者，后来扩增到4万3千例。然后到11月初的时候，已经这个中期的结果已经出来了。And because it is likely, and both vaccine will be authorized on the U.S. market by the end of this month. And so there has been piece of information and from news. So I just put everything what we know so far for these 2 vaccines on this table summarized. And so people have good understanding and then pros cons for each one. The first one start with Pfizer mRNA vaccine BNT162b2 and require 2 intramuscular injections 3 weeks apart. And for Moderna, it's also 2 intramuscular injections 4 weeks apart. And the phase 3 trial for Pfizer and 43661 subject, and 30% are coming from US. And they claim to have and racially ethnically diverse, but don't have the detailed information. About close to half are people 56 years older. And for Moderna, and they have 30,000 subjects. And interesting enough, and when Moderna designed this trial, they worked with NIH. They specifically enriched the trial subject population to contain people with high risk for the COVID, high risk people for the COVID-19, which includes 7,000 people subject and 65 years or older, and 5,000 subjects with a chronic condition. And they also claim to have diverse ethnicity. Close to 40% are coming from minority. Efficacy and very similar, 95% preventing symptomatic infection, right? And I don't need to read the number, but one thing I want to mention here, out of 170 confirmed cases, there were 10 had a severe disease, 9 from placebo and 1 from vaccine group, which means the Pfizer mRNA vaccine did not prevent all the severe diseases. And compared to Moderna, and also 95% and efficacy in terms of preventing symptomatic infection. And interesting, they had the 11 severe cases, but all in the placebo. There is 0 severe cases in the Moderna vaccine group. So this indication, this possibly, although the number of severe cases is small, but it's possibly this Moderna vaccine not only can prevent symptomatic infection, but even then among the 5% people who did develop infection, none of them is severe. And for subgroup, and there's no detailed information, but both companies claim their results were consistent across age, gender, race, and ethnicity. And for safety, and Pfizer vaccine and grade 3, which means severe adverse events, severe safety events, 2% or higher, and Pfizer vaccine only reported in the public right now is fatigue and headache. Also, interesting enough, and they also mentioned for older subjects in the trial, actually generally have less adverse events. And for Moderna, and they had more safety data. So for severe adverse events, we reported injection site pain, fatigue, myalgia, arthralgia, headache. This is the pain of a muscle. This is the pain of a joint, just in case. Headache, pain, unspecific pain, and redness at injection site. Those are generally not all the events generally are short-lived and can recover quickly. And there's no serious adverse events that require hospitalization, etc. Then the next one is, I think, is important for Pfizer vaccine, and they have specific storage requirement, and they have to be minus 70 Celsius degree. So for that reason, and Pfizer had to develop a specific thermal shipper and for the vaccine, but that still requires and people fill in the dry ice periodically, and so the vaccine can stay in the shipper for and during the transportation. And Moderna vaccine doesn't have that requirement and generally stable under the routine freeze condition 2 to 8 Celsius degree and for as long as 30 days. And with regard to the availability, it likely Pfizer vaccine will become available earlier because they already submitted the EUA last Friday. And right now, FDA plan to have a advisory committee have open independent vaccine data by December 10th. And so if FDA going to move ahead approve for this vaccine, and based on I'm hearing from US Department of Health and Human Services, the vaccine will be supplied for vaccination in the United States within 24 hours. So likely that will be December 11th and 12th. This vaccine will be supplied for vaccination in this country. Moderna, based on my understanding, they plan to submit within a couple of weeks. Likely will be a matter of days, right? And we don't have the clear data yet on that. So production capacity for Pfizer vaccine, they will have 50 million vaccine doses in 2020, half that for United States. And Moderna, if they got authorized by FDA, they'll have 20 million doses in US by 2020. So if you add these two together, likely by end of December, if everything goes well, and by end of December in US, we'll have close to 45 million doses mRNA vaccine available. Each person needs two doses, 2 shots. So what that means about 20 million US people in US likely will have the vaccine by the end of December. And the price, so the Pfizer and government got a good deal by the contract, about $20 per dose. And Moderna, they give US a discount because US government invested $1 billion in early development. So $25 per dose. And for outside the US, it's more expensive. 这个呢，我就用中文简单说一下，因为这个，现在我们就是已经公布结果的比较理想的2个疫苗呢，都是 mRNA 的疫苗。然后呢，这个我把所有的现在已知的信息都总结在这个表里面。有可能在今年年底的时候，这2个疫苗在美国都会有可能都会上市，就是作为一个紧急授权的形式上市。所以呢，有必要大家知道一下这2个疫苗它们的这个优缺点是什么。然后呢，这2个疫苗的共同地方就是它们都需要2针的这个肌肉注射。第一个疫苗呢，大概是2针之间隔3周，第2个疫苗2针隔4周。然后他们的临床试验呢，其实有必要看一下，因为它这个临床结果呢，就跟将来这个上市后的这个疗效会密切相关。这个辉瑞这个疫苗呢，3期临床做了43000个这个志愿者，然后30%是在美国做的，剩下的人来自其他的一些国家，然后有45%左右的人是在56岁以上的，相对年纪比较大的。然后这个 Moderna 这个疫苗，它是跟美国国立卫生研究院做的，全是在美国，3万以上的这个志愿者全是在美国。然后他们专门的找了一些这个，在这个新冠这方面具备高危因素的这些人，然后其中42%的这个他的这个临床试验都是这样的人，包括了7000例这个。65岁以上的老年人，还有5000例这个有慢性疾病，像这个糖尿病啊、高血压这些病人，然后他们的这个种族这方面的也比较多样化，将近40%都是少数民族，所以我感觉这个 Moderna 这个疫苗呢，就说代表性更好一点，因为它确实更包括了很多这个新冠有高危因素的人群，我觉得这点是从它将来这个预测它将来上市以后的疗效这方面，我觉得更有利一些。然后对这个疗效来讲呢，都达到了95%，它这个90%计算的是有症状的感染者就达到了95%。一般这个疫苗的临床实验，它有3个结果，一个就是有症状的感染这个疗效是多少，另外就是严重这个感染的疗效是多少，所以预防严重感染之前疗效多少，另外就是在预防任何感染的时候疗效，有症状没有症状加在一起的感染的疗效是多少。现在公布的数据呢，基本上都是在这个有症状的感染这方面的疗效，这2个疫苗都达到了95%。然后呢，另外想说一点就是这个辉瑞这个疫苗呢，170个这个确诊的这个病例中间呢，有10例是严重的病例，然后其中9例在这个对照组，有1例是在疫苗组。然后 Moderna 这个疫苗呢，有95例确诊的病例，11例是严重的，然后他们全部都是在这个对照组。就是说 Moderna 这个疫苗虽然现在这个病数很少，但是 Moderna 疫苗有可能也能够预防这个严重的这个疾病。就是说它即便这个在疫苗组里面有5例接种它的疫苗了，得了感染了，但是这些人都不是严重的病例。这是 Moderna 这个疫苗也是在它疗效方面相对而言比较，就是能够突出一点那个地方吧。然后在这个亚群中间呢，他们说这2个疫苗都没有具体的数据，都说在年龄、性别和这个种族这方面没有任何的区别。安全性这方面呢，这个辉瑞这个疫苗的安全性数据好像看着好一点，就是相对比较严重的这个安全性事件中间，它只报了4%的疲劳和2%的头痛。然后他说，甚至年纪大的这个受试者呢，他们这个安全性的数据更好，因为这些安全性的反应都是跟免疫反应、跟人体的免疫来的。年龄比较大的人呢，他免疫相对比较弱一点，所以这个安全数据更少，所以也可以理解。然后 Moderna 这个疫苗的安全数据呢更多一点，他就说，比如说注射这个部位会比较痛啊，然后那个像这个疲劳、还有肌肉痛、关节痛啊，还有头痛啊，这些他的报告的这个比例相比这个辉瑞这个疫苗高一些。然后另外就是储存的条件，这个辉瑞疫苗呢，储存条件要求比较高，它必须要在零下70摄氏度储存。这个呢就是一个非常特殊的要求，所以辉瑞呢现在自己 已经设计出了一个专门运输疫苗用来的一个保温箱，然后里面必须要装干冰，然后随时的换着干冰，才能把这个疫苗能够保持下去。然后这个 Moderna 疫苗就没有这个要求，它只在普通的冰箱下，它有效期可以保持30天，这是这个 Moderna 疫苗一个非常大的优势了，因为现在所有的已知的疫苗，它的这供应链都是在这种条件，就是在这个冰箱保温的条件下来供应的，所以 Moderna 疫苗它不需要任何特殊的要求，所以它可以直接融入应用到现在的疫苗这个供应链中间去。然后这辉瑞这个疫苗呢，它上个周五的时候已经递交了 FDA 的这个紧急授权的审批，现在 FDA 初步要定在12月10号，要请这个 FDA 的这个专家委员会，全部都是 FDA 之外的这个领域比较有名的专家，做一个独立的、公开的大家一个讨论，然后给 FDA 一个是不是审批的一个推荐。如果这个疫苗呢，最后被 FDA 授予了这个紧急授权的话，现在美国那个卫生和人力资源部的这个负责人也说了，那么这个疫苗在24小时之内就在美国就可以开始提供，然后开始注册，开始使用。这个 Moderna 这个疫苗呢，现在他们也说他们会尽快递交申请，估计也就是几天之内的事情了。然后呢，他们这个生产的这个生产这个能力呢，在今年年底之前，辉瑞这个疫苗呢，可以向全世界提供5000剂，其中一半2500剂呢是在美国的。然后那个 Moderna 这个疫苗如果被 FDA 授权的话，在今年年底之前也可以给美国提供2000剂的剂量的疫苗，所以这加在一起2000剂在 Moderna 的疫苗，2500剂加上辉瑞的疫苗，所以对美国来讲，如果一切进行顺利的话，美国这个国家在今年年底12月份年底的时候呢，就会有4500剂的这个 mRNA 的疫苗。然后呢，因为每一个人呢需要打2针，所以除以2的话，大概就是2000万的美国的这个公民，在年底之前就有可能有这个新冠疫苗来可以至少在美国能够提供给2000万注射的需要。然后价钱呢，这就不说了。这个美国政府因为在这边有投资，在这方面也提前锁定了一个合同，所以呢，价钱相对比较优惠。Okay, a couple of things. I think this is pretty significant, not only because we had a vaccine and for COVID-19. There are a couple of things. Number one, there's a proof of concept for mRNA vaccine. This is very exciting, right? And because you do have two vaccines and developed by 2 different companies with 2 different formulations, and both prove to be effective. So this is quite a strong evidence. mRNA vaccine as a platform is good, and for vaccine for other diseases as well. Think about other viral diseases that we have a lot of them, and right now using old technology. And also exciting to see the Moderna vaccine actually can not only prevent asymptomatic infection, but also potentially can prevent the severe form of the disease. That's exciting too. And the second is a proof of concept for the target, because right now all the COVID vaccine are targeting on spike protein, right? So, and we before these 2 vaccines, and people don't know whether that's the right target or not, whether they're going to be successful or not. If it fails, and that'd be tragedy, because no other vaccine targeting other things. But the good news is, and from the success of the two mRNA vaccine, looks like the target is right, and we should provide a proof for other vaccines. And you guys did target on the right and right part of the virus. The third is a proof of effectiveness, and before. And we had this phase 3 results read out, and everyone used neutralized antibody level as a surrogate and for the protection of the infection. But no one knows whether that's true or not. And right now, and these 2 mRNA vaccine phase 3 trial read out and prove that is valid surrogate outcome. So this is useful for other vaccine development, and also useful for understanding what the protective immunity even coming from natural infection. and 这里面呢，我就想简单说一下这2个疫苗的结果，这个出来以后呢，是比较有积极的意义的。第一个就是它证明了这个 mRNA 疫苗这个它的整个这个理论， 是正确的，确实呢，因为以前没有任何 mRNA 疫苗这个开发的这个经验，所以这2个疫苗在不同的公司同时研发，同时取得成功，说明这个 mRNA 疫苗在这个将来疫苗的研发方面是非常有前景的，就是它可以，不光是为将来新的疾病，甚至一些其他已有的疾病，现在已经有的一些比较老旧的疫苗，我们将来可以考虑用 mRNA 疫苗来取代，and 另外就是这个疫苗的成功呢，也说明我们现在对新冠病例的这个靶点，针对它这个 spike 那个蛋白是正确的。因为现在所有的新冠疫苗都是针对这个靶点，如果这个靶点如果失败的话，那现在就是在新冠疫苗研发面就是一个很大的一个挫折。但至少好的消息是我们现在2个 mRNA 疫苗结果证明这个靶点选择是正确的。第二呢，就是现在疫苗的研发中间一直用的是这个中和抗体来确定来假设。就如果疫苗能够诱发中和抗体，那个疫苗将来就会提供保护，这是一个假设，谁也不知道这个假设是不是正确的。然后现在这2个 mRNA 疫苗的结果出来以后，大家知道这个用中和抗体做这个假设，这个假设是成立的，这也给将来这个新冠疫苗其他疫苗的研发这个铺平了一个道路，所以这个结果是很有意义的。从这些角度来讲。当然还有很多其他问题还有待于进一步的回答。There are still remaining questions, right? And from the results and need to be answered. How long the immunity can last, right? And how long the protection can last and for the individual patients. And will the infection occur? If so, after vaccination will be less severe for the infection. And whether the vaccine works in elders, people, chronic condition or compromised immune system, and these people generally do not respond well and to the antigen vaccines, whether this vaccine works. How about the children? And the trial did not including the children, and whether the vaccine worked in this population, we don't know. How about the long-term safety? And mRNA vaccine is a new concept. We never had any experience on that. So what is long-term safety? And can vaccine prevent the transmission? Right. So this is another question, and not only prevent the symptom infection, but can that also prevent the transmission? And for people who actually get infected after vaccination, whether the probability that these people transmit the virus to other people also get reduced. So there's a couple of things and a couple of questions here. How to overcome the supply chain challenge, especially for in under-resourced areas and with warm climates, especially for the Pfizer vaccine. And long-term future outlook, and even with this vaccine become available, how this epidemic can look like. Is that going to turn into an epidemic with the seasonal outbreak or longer spells quite calm period, and then suddenly have the reemergence, and how the healthcare committee can deal with that. So these are the remaining questions that remain to be answered. So the good news for the first question, I think, is a key question: how long the immunity can last. And one thing, just want to mention, there's some good news coming from that. And there are a couple of research and indicating that while and after the natural infection, the COVID, and while the antibody may be decreasing, but the memory immune cells actually increased time are pretty stable, at least within 6-month period of time, and that offers a period of protection. So if that all stands true for vaccine, what that means, the after vaccination, the immunity, the protective immunity, and may potentially last longer than what we initially expected. So lastly, I also want to mention, and even if we had a vaccine, but if people are not willing to and use it, that's become useless, right? So, and there has been some surveys done among American people, and about the willingness of receiving the vaccine. And you can see this is a survey done May and September, and for the political reasons, people who are willing to receive the vaccine definitely probably and have been reduced from 70% to 50%, and which is true for both Republican and Democratic Party, which is not good news. And the good news is most recent and survey and done by Gallup, and they just announced today actually increasingly interesting to see ever since September, and the willingness people are receiving the vaccine and slightly increased from 50% to 58%, and this is primarily driven by the people with from Democratic Party and also elder population。用中文简单说一下，就是有一个好的疫苗，这个如果美国老百姓不愿意用的话，也没有用。这个呢是在美国老百姓中间做的一个调查，就是有多少人愿意使用这个疫苗的。然后从5月份到9月份，大家看看，因为有很多政治因素在里面，这个愿意接受疫苗的从70%降到了50%。然后在这个民主党和共和党之间，这个都有明显的下降趋势。然后好的消息就是，但是总体的意愿呢，也开始从9月份开始逐渐上升。然后现在呢，最近的一个调查呢，从50%上到将近60%。然后这个主要呢是这个民主党还有这个老年人，他们这个对疫苗的这个接受率逐渐有提高的趋势。的红线呢是共和党的这个选民，他们对这个疫苗的这个接受程度没有变化。The final words and the feeling hope, right? And we're moving towards the end of this year. And 2020, everyone probably agree this really has been a year of turbulence, uncertainty, and a crisis. But given what we learned from COVID-19, I also give a positive note is 2020 is also the year of incredible scientific achievement. And think about what we have done for the disease in the less than 11 months. And basically we worked collaboratively within the scientific community to characterize a novel and highly contagious disease we've never seen before. We sequenced the new virus genome and shared on an open platform, and we developed diagnostic testing and at various venues, public, government-sponsored, private institution, and produced a treatment protocol and identified the effective treatment regimens, and also developed vaccine candidate from the laboratory, and then we established efficacy and safety for both drug and vaccine using randomized controlled trials. Everything get done in 11 months. And so after this, even may well be another newly emerging infectious diseases, and but positive things. And if we can work together within the scientific community, and with little reduced influence from political interference, I think we'll be much better prepared in the future. 最后结束语呢，就是说希望之光啊，就是说我用中文简单说一下，2020年这一年快结束了，到10月底了。这一年我们确实有很多的挫折，很多的这个不定和变化，这种危机。但是从这个新冠这个角度来讲呢，从科研的角度讲，我觉得比较有这个有正面的意义的，就是确实这也是我们科研这方面是一个非常有成果的一年，在短短的10个月的时间，我们整个全球的这个 scientific 这个全球科学家合作在一起，把一个病，一个从来没有见过的一个非常剧烈的传染病，把它研究清楚，然后呢，又把它这个病毒的这个基因序列测出来以后，全球共享，然后根据这个基因序列，我们成功的研发出了个诊断的测试的方法，然后呢又筛出了有效治疗的这个药物，然后我们在实验室里面也研发出来了有效的这个疫苗，然后同时呢就完成了这个用这个最严格的这个临床实验，把他们这些治疗方法和疫苗的有效性、安全性都做出了测试。短短的不到11个的时间，整个我们全球的这个科学家们完成了这么多的这个成就，这是从这个科学研发，从这个新药和疫苗研发这个传染病控制角度来讲，是一个非常了不起的成就。虽然将来有这样的经验和经历之后，虽然将来我们会有另外其他的这个新发的传染病，但是我相信我们这个全球的科学家能够在一起合作。少一些这个政治的影响的话，我们一定会做得更好。我就说这么多。I'll stop here and see any questions and anything that you want anything, any questions from the audience, any comment.
And then there are a couple of questions.
Sure.
About other vaccines. Can you say it briefly? Because we are over time already. 这边有2个问题，就是关于其他疫苗的发展情形怎么样？
There are not much of advancement with regard to other vaccine, and there are 2 adenovirus vaccine, and one is developed by Oxford and the group AstraZeneca, and that vaccine had some safety events and was put on hold in United States more than a month. And I think only update from that is, and recently the FDA, after review their safety data, agreed to continue the vaccine development, and they also report their phase 2 data, and without any efficacy on the protection and infection, but just looking at level in neutralizing antibody, looks like the vaccine was able to produce strong neutralizing antibody among the elders, which is a good thing. But we still don't have their phase 3 trial results readout yet, which was a little bit disappointing because that vaccine, I think, entered the phase 3 earliest and with a lot of hope. But I think the 2 safety events and really had a setback for the vaccine development. And similarly, in the same class, I think Johnson & Johnson also had a adenovirus vaccine, and they put on hold because of safety results. But that only short period of hold, only 11 days, and later resumed. But so far, there's no phase 3 readout yet. And there's another vaccine, an adenovirus vaccine developed by Russia and claimed to have 92% success rate and efficacy after the Pfizer announced their efficacy result. But so far, we do not see any detailed data being provided yet. And right now, that vaccine only had a phase 1/2 data readout, which is only very small number of patients, subject. So there's insufficient information to support that vaccines indeed that effective. And there are a couple of inactive vaccine and developed by the Chinese research team, and so far there has not been a phase 3 data readout. And people are suspicious that maybe giving that in the phase 2 data, their antibody level is not, neutralized antibody level is not as high as mRNA vaccine. So there's speculation maybe their protection, really protection to infection is not as good as a mRNA vaccine. That, of course, that's a speculation, and we need to see their phase 3 data.
So, do I understand you correctly that right now only these 2 vaccines are promising? No,
and based on the current available data, these 2 vaccines and really already, based on available data, already passed the bar FDA established for the vaccine approval, right? And their efficacy above 50%, and there's no significant safety concern. So it anticipate these 2 vaccines will become available at the end of this year. Other vaccines during the phase 3 trial, there's no data has been disclosed, and to see one way or the other.
Okay. I'm curious that the Moderna vaccine doesn't need to be kept in an ultra low temperature. Why is such a big difference between Moderna and Pfizer?
That's a good question. I don't know. Generally, this become both are mRNA vaccine, but the formulation is different, right? And I don't have a detailed information why Moderna vaccine doesn't require such requirement. Sorry, no further insights on that. But I know it's from Pfizer team, and they are already moving to have a 2nd generation of their mRNA vaccine, and the target, the 2nd generation, is to remove that storage requirement.
Okay.
Yeah.
One more question about safety. Do you think 2 months safety data is enough?
From typically vaccine safety and data, yes, 2 months should be enough. But do we need more? Definitely, we need more, especially for long term, right? It is a new type of vaccine platform and concept. We definitely need more, understand better the long term safety. The reason answer yes is because, and based on what we know about all the safety events associated with the current approved vaccine, and 90 to 95% of those events occurred within first 6 weeks of vaccination, because those events generally are associated with immune response and generally will manifest within the first 6 weeks. So that's why 2 months generally will be sufficient to have initial and determination whether the vaccine is safe or not. And again, FDA is not going to grant a full approval for either one of the vaccine. They only give a EUA called emergency use authorization, which is not a formal approval. And these two companies will be required to further follow up their patient their subject in the phase 3 for long-term safety. And also, once one vaccine start becoming available to the public, the company will be required to continue monitoring the safety. And once people outside in the community receive the vaccine, so that's generally it's going to be a requirement from the FDA.
Can you say this in Chinese? The last question about safety.
行，我简单说一下，刚才金勇士就问这个Moderna 这个疫苗或者包括 Pfizer mRNA 疫苗，安全性只有2个月的数据是不是够？我的简单解释就是，从这个只做一个前期的一个判断的话，2个月基本上是够了，因为据现在大家对这个现有疫苗的这个安全性来讲，他们那些安全的那些就是不良的事件发生，都是在接触疫苗之后6周之内就出现了，所以2个月呢，大概从这个时间来讲呢，所以2个月应该是够的。但是呢，因为这个 mRNA 这个 vaccine 呢，就是这个疫苗呢是一个新的这个概念，就是以前还从来没有任何疫苗这个被批准过，所以我认为那个美国的药监局肯定会要求这2个公司这个对3期临床试验所有的受试者都继续追访，看他们长期的安全性。同时呢，这个疫苗上市以后，进入社区以后，所以接受的人群中间有什么其他的不良反应，可能比较少见的不良反应，甚至可能比如说10万或者100万中间才能出现一例这样的不良反应，然后呢也会进行监测。
Okay, I think it's pretty late now. I thank Dr. Wang to give us such a detailed and insightful presentation. 已经很晚了，我们要结束。感谢王博士做这么详尽的分享。And before we end, I just want to a quick announcement. This next week is going to back to the forum, and this will be Nippon Meta is going to talk. And I think to save time, I'm not going to explain much about him. He's a young person, volunteer, and lots of achievement. So it's got many awards in US and in other countries as well. So it's really promising. And we have translator, the Chinese translator. 那下礼拜就是我们回到这个研讨，是那个Nippon，他跟我们分享。Nippon 还蛮年轻的，他是很优秀的一个年轻人，所以得到很多奖，所以想应该会给我们做什么。那翻译的人是 Carol 许，翻译成中文和华语。我们来做个回向 ，Let's dedicate memory to. No need to stand up, just sit in your seat, and we'll chant us in English. 用英文来唱这个回向偈。Merit from the spreaders, but all the goodnesses repay the kindness from above and rescue those in pain below. May all see or hear others result upon awakening, and when the Spati makes us happy, home together in the land of praise. 3 bows. In respect to Venerable Master, thank you again. Amitabha, thanks everybody.
Amitabha.